Welcome back. Breastfeeding Week was launched by the Ministry of Health at the McCoy Health Centre this morning. Breastfeeding Week is held annually to draw attention to the importance of breast milk in the early stages of a baby's life to ensure a healthy child in the future. Fiji became the first country in the Asia-Pacific region to achieve baby-friendly hospital status by ensuring that all maternity facilities encourage exclusive breastfeeding.
Fiji has all its hospitals as baby-friendly, and something that has been achieved by Fiji as the first country in the Pacific that has achieved this initiative and also this achievement. And this week we are promoting breastfeeding to all mothers. At this point in time we have 40% of all mothers around the country.
Penny Namotu said that the ministry is promoting breastfeeding, which is best for the baby and provides not only a preventative health but also a complete nutritional package to the infant babies.
What we are promoting is that for babies, for mothers to breastfeed their babies exclusively in the first 6 months, and after that they can continue up until 2 years of the baby with the complementary food. So babies has to be breastfeeded exclusively in the first 6 months before moving on to complementary foods until 2 years of age.
This is something that has been emphasized by the Ministry of Health, and all mothers are advised that there are other diseases that are rising now is due to the fact that of mothers not breastfeeding their babies properly.
The rubella outbreak has increased from the initial 8 cases to 11 confirmed cases in the Greater Suva area. According to health spokesperson Penny Namotu, there is a high possibility of the outbreak moving to other parts of the country, and the public, especially pregnant mothers, are urged to get themselves immunized if they haven't already.
At this point in time, we would like to educate the public on the symptoms of rubella. Basically, it starts off with a mild fever and then goes on with the development of rashes. So if anyone or any individual happen to develop these symptoms, they have to attend to a medical facility immediately.
Penny Namotu said it is important for pregnant mothers to seek medical attention once they contract the virus, as they can result in birth defects.
And also some early pregnancy stage, there can be complications like a miscarriage. So pregnant mothers have to keep away from those people that have contracted rubella. And what is important is for people to present themselves immediately if they happen to contract the symptoms of rubella, basically because there will be early medical intervention and also avoid the spread of rubella.
Rubella is an airborne disease and can be spread at a very fast rate, and members of the public have been advised to take extra precautions.
The island of Vanuatu in the Lau group has struggled over the years to have proper drinking water. A signing of a memorandum of understanding this morning with the UNDP will certainly bring much-needed relief to the islands in the future.
The chairman of the Vanuatu Island Development Committee, Mr. Yaminasi Ngonovo, this morning signed the Memorandum of Agreement with the United Nations Development Programme for a 2-year development project that focuses on conducting climate change awareness for the islanders, promoting sustainable land use and water management practices, and the promotion of long-term sustainability with the context of an island development plan.
But the history of Vanuatu Island is a history of survival. When I say survival, there's no water on the island. And our great forefathers were not accessible to any form of education. But they had depended entirely on their God-given skills to survive on an island that was given to them by God Almighty.
Food and water security are two critical issues of importance to isolated island economies such as Vanuatu, who together with rapid sea level rises and soil erosion are future threats to their generations. For UNDP, raising the awareness among small island economies is critical. Thus the need to also provide both financial and advisory support to those affected.
It has proved far more resilient and far more environmentally appropriate, but also complex than initially supposed by ourselves. So it is very encouraging that we know that you will be working through those systems and making use of the benefits that they will provide.
The project includes a community climate change awareness and adaptation planning, establishment of a community sustainable land management and pilot model farms, sustainable agriculture training for youths, establishment of an island community nursery, a community solar still, water management, utilization and storage training, island development plan, and utilizing project objectives for strengthening livelihoods. UNDP provided US $50,000, the Vanuatu community $31,000, the Vanuatu Island Development Committee $3,700, and the Fiji government an additional $47,000. When one considers the hardships faced in the past by small island economies, this new project initiative by the Vanuatu Island Development Committee will certainly bring much needed relief and blessings to the people, when literally translated means a rocky land, thus the reason for no water.
And that's it from the news team. You can email us your comments to FijiFocusTV@info.gov.fj. Until then, thank you for joining us. Good night.